Welcome to this proning video being developed for training purposes. At the head of the bed we're going to have a poster. On the other side of this poster is a picture. On this side are three sections. The first section is the preparation and checklist for preparing for proning. The midsection is the proning procedure checklist, and the final section is the supine procedure checklist. The first section is titled Prior to the Turn. First, eye care. Normally these patients will be on neuromuscular blocking agents, a paralytic agent. Eye ointment is instilled and the lids are taped shut to protect the eyes. Tongue care. Because facial edema occurs in the prone patient, ensure the tongue is inside the mouth. If the tongue is swollen or protruding, insert a bite block. Enteral feed assessment. The patient receiving a gastric feed is at an increased risk of aspiration while prone. The gastric fed patient is assessed for a small bowel feeding tube used to provide post-caloric feeding and inserted while the patient is in supine. Emergency proning is not to be held up for this feeding tube. The doctor may order trickle feeding, 10 mL per hour via gastric tube while the patient is proned. Gastric drainage assessment. The pyloric fed patient may simultaneously have gastric drainage. This further ensures protection from aspiration. Check all lines are secure. Change any dressings as required. Empty all collection bags. Examine the patient's chest for areas vulnerable to pressure. Example would be a stoma. Place a pad around the stoma to prevent direct pressure on the stoma. Collect required pillows. Minimum required is 5. Depending on the patient's habitus, more pillows may be required. If the patient has a large abdomen, then more pillows will be needed over the chest and pelvis to take pressure off the abdomen. Set up end tidal CO2 with waveform. Assign one person to watch the waveform during the turn. Losing the waveform is the very first indicator of loss of the airway. Position flat sheet under patient and move ECG leads to back. Do not use a stretchy fitted sheet. Lines above waist, position to head of bed. Lines below waist, position to foot of bed. Airway and line manager identified.
John.
Minimum of 5 staff members. Evaluate endotracheal tube distance at teeth or gums if no teeth. The lips will become swollen in the prone patient and should not be used for endotracheal tube distance. The middle section on the checklist is turn prone. Airway and line manager directs the turn. Maxi inflate airbed. Position face in direction of ventilator. Position arms closely beside body, fingers pointing to toes. Cross feet at ankles, foot opposite to ventilator on top. Place pillows across chest, pelvis, and shins. Position incontinent pad across chest and midsection. Ensure the upper edge of the pad is at the top of the shoulders. This pad position is essential in preventing any head extension or flexion while doing the head turn of the prone patient. It allows the chest to be elevated high enough so the head turn is done with absolutely no head extension or flexion. Any head extension or flexion shortens or lengthens the endotracheal tube in the trachea, and this can cause unwanted extubation. Position flat sheet over patient including head, full back section over face. Sandwich patient with jelly roll using top and bottom sheets. Remove pillow under head. Airway and line manager directs team in moving the patient to side of bed furthest away from the ventilator. Airway and line manager directs team in conducting turn to side, then a pause. The turn is done slowly.
All right, on 3, 2, 1.
Airway and line manager directs team in conducting complete turn.
Everybody's ready? 3, 2, 1.
Airway is immediately assessed. Check endotracheal tube securement. The bottom sheet is pulled up under the head. Two staff members together use the bottom incontinent pad as a lifter. The chest is elevated slightly while the bottom sheet is pulled up, and any further incontinent pads can be placed at this time. Position pillow under head, leaving the face free from a pillow, and ensure no tubes are under the head and the ear is aligned, not folded. Position patient into swimmer's crawl. Arm in an up position is behind the head. This keeps the up hand and arm away from the face and tubes. Place down arm at patient's side with palms up, or down with bended elbow, palm face down. Swimmer's crawl example. Don't put the arm too high. It can cause strain on the neck, and the arm that's down can be positioned to the right. Optimize positioning and minimize pressure points. Shoulders should be relaxed and dropped. Avoid shrugging. Feet should be dorsiflexed with ankles at 90 degrees. Cancel maxi inflate. Put bed in reverse Trendelenburg 10 degrees. Never use OptiRest. Every 2 hours, turn the patient's head and alternate arm positions. Remember to lift the chest on head turn high enough to prevent any head extension or flexion during the head turn. The last section on the checklist is turn supine, with airway and line manager directing the turn. Delete reverse Trendelenburg, position bed flat. Lines below waist position to foot of bed. Lines above waist position to head of bed. Move ECG leads to anterior chest. Attach leads to sides of abdomen and top of shoulders. Chest lead can be placed after the turn. Assemble staff. Remove any side-lying pillows, put bed and maxi inflate. Airway and line manager directs team in turning patient's head away from the ventilator. Tuck arms of patient close to body with hands under hips. Cross feet at ankles, foot opposite to ventilator on top. Position incontinent pad across back and midsection. Position flat sheet over patient, including head. Fold back section over face. Sandwich patient with jelly roll using top and bottom sheet. Remove pillow under head. Airway and line manager directs team in moving patient to side of bed, furthest away from ventilator.
Everybody on 3, 2, 1.
Airway and line manager directs team in conducting turn to side, then a pause.
Ready? 3, 2, 1.
Airway and line manager directs team in conducting complete turn. Assess airway, check endotracheal tube securement. Pull bottom sheet up to cover top of bed. Align patient and pillows to promote comfort. Cancel maxi inflate. Thank you for watching this video on proning, and it is part of the training program, and there's also a teaching package on proning to follow up and give the rest of the information on proning. Thank you.